Okay, Annette, can you go ahead and tell me? So we're seeing an increase in numbers and hospitalizations, nationwide. Are we starting to see that here in the Corpus Christi and Nueces County area?
Absolutely. Unfortunately, but yes. And so, a few weeks ago, we were, at 18 hospitalizations, 16 hospitalizations. We were thinking, wow, hospitalizations are finally, coming down and doing fairly well. They're not down to zero, but they're definitely coming down from the high 50s we were seeing a few months ago. But now, as everybody knows, the last few days we've been almost up to 50 again. So yesterday we were at 49 hospitalizations, the day before 44, the day before 41. And so those numbers have just been continuing to rise in the hospitals.
And so, also, when it comes to this new variant, we are seeing that this Delta variant is kind of becoming more prevalent in the United States and in several states. Have we seen that in our in Nueces County yet, or we haven't seen that just yet?
We don't have an official document that shows that we have Delta here in Nueces County, but it seems obvious to us that Delta variant is circulating here in Nueces County just because of the sheer number of cases that have increased as well as the hospitalizations. So everything is indicative that we have a variant that's more transmissible here in our community.
And so, is there any testing that maybe would be done in the future to determine if there is Delta in the area?
Yes, yes, we're actually now allowed to start sending some of our samples off to verify if it's Delta. So the Delta is a little different in the original COVID-19 virus and even in the Alpha variant, which is the B.1.1.7, in that this one you're actually seeing people that have like the severe sore throat, like having trouble swallowing. And so we're looking for those individuals that are positive, and we're starting to send that off to the state. Now, the issue is it takes about a month to get results, but still, we want to find out if the Delta is circulating here in Nueces County.
So why is it important? I know we've still seen instances where fully vaccinated people are getting the virus, and we've seen cases of the Delta variant being transmitted into fully vaccinated people as well. But it seems like the symptoms aren't as harsh as experiencing that without being vaccinated. So how important is it for people to get fully vaccinated?
Yeah, it is really important. And we've been contact tracing, a lot more this last week and a half. And we've been telling these individuals because there's, like you said, many of them have not been vaccinated, don't have any desire to be vaccinated. And so we're just trying to talk with them and kind of understand what their thinking is, why they haven't been vaccinated. I think a lot of the ones that I've talked to this week, their concern has been for their children. They're this is a new vaccine, Pfizer, the mRNA. Why should I give it to my 12-year-old? What if something happens to them? We've seen these things happen with J&J and with the other vaccines. And so just talking through that process with them seems to kind of give them some relief. One of the main things that I remind them is that I have doctors that call me every day asking me, Annette, has the vaccine been approved for my 5-year-old, for my 2-year-old, for my 6-month-old? And so when you have doctors that are really wanting to get those vaccines for their little for their children, I think it's important for our community to remember that, to say, we trust these doctors. They would not have their child vaccinated if they felt that there was a possibility of harm to getting vaccinated. And I think that's really important, and that we need to remember that if you're not vaccinated, you're, a standing duck, so to speak. You're right up there, just basically saying, I'm able to get COVID-19 if anybody around me has the virus, even if they're asymptomatic and they don't know it. So again, it is important to get vaccinated. And I agree with what you said. These people that, some of them that I've talked to this last week, they were outbreak cases. So vaccine breakthrough cases, they actually were fully vaccinated and then they got sick. What one of them told me was, I'm so grateful that I got COVID-19 after being fully vaccinated, because I'm an older individual and who knows what the outcome would have been if I got it before I had been vaccinated. He said this time it was mild to not even probably moderate in medical communities, we don't see it as moderate, but it was like a mild symptomatic virus. And so he was grateful for that, and we are as well.
And so when it comes to, you know, those individuals, we have seen that individuals here in Nueces County that are fully vaccinated have gotten COVID-19.
Oh, absolutely. I mean, that's everywhere. We have vaccinated so many individuals, I would say at least a couple of hundred, individuals. But again, these people are not being hospitalized. And that's the main thing. If we're vaccinated and we get the virus and it just feels like a typical seasonal cold, we're all okay with that. What we're not okay with is we get a flu and we end up in the hospital on a ventilator. That doesn't seem fair to anybody. And so the vaccine is to help to keep that from happening. And that's really why we want to impress upon people, get vaccinated so that way that doesn't happen to you. Nobody wants to spend any time in the hospital, especially for a virus, So a lot of people were saying it's a lot like a seasonal flu, and then we quickly found out it's not like seasonal flu. Seasonal flu doesn't usually send you to the hospital. So again, get vaccinated and don't ever worry about having to be hospitalized or be put on a ventilator, because that's very scary for family members and for the person that's being put on the ventilator.
And so, Annette, when it comes to, we know that several of these restrictions that we had previously have been relaxed. A lot of the mask wearing in public places, there are still some places here that do require masks in their businesses. But, a lot of the gyms, a lot of the nightclubs, a lot of the bars here aren't requiring these masks. So should people not let their guard down? And if they're going to go out and be with a lot of people in one area, should they still consider wearing a mask?
Absolutely. And I know that people don't want to hear that. They want to hear throw away the mask and you're good to go. Fully vaccinated people are at a lot less risk for even picking up the variant, but people that are not vaccinated, they for sure should be wearing a mask, and unfortunately what we're seeing now is the hospitalizations, they're younger. And the reason they're younger is because that's that age group, between 20 and 35, 40, that they kind of think they're invincible. I haven't gotten it yet. It's been a year and a half. What makes me think I'm going to get it now? I'll just be without the vaccine. I'm fine. But they're getting it and they're ending up hospitalized and they're ending up in the ICU. And so that's where we're really, and I don't know that people actually believe that. And I wish there was a way that I could prove that to them, show that to them. The only way it becomes real, to be honest with you, is when it becomes one of their family members. And then it's real and it's in their face and they're like, oh my God, I should have made that decision to get vaccinated. And so I'm hoping that we can encourage people before that happens, but that is what we're seeing. We're seeing a younger population being hospitalized, and only because they haven't been vaccinated. So I think everybody's seen about 99.5% of those that are hospitalized have not been vaccinated. So that gives you some credibility for the vaccine. The vaccine works. It's available to us. This is now considered a vaccine preventable disease. There's no reason people should be picking up COVID-19 to the extent of being hospitalized if they would just get vaccinated. But you do have to follow your other public health precautions. We don't want anybody to forget about those. Hand washing is so important. That's almost, if not the most important thing that you can do, is constantly washing your hands, not to the point that you break down the skin. Because I've seen people do that too, where their skin is breaking down. Then it doesn't protect you anymore, because your hands, your skin is also your best protection. And so, but washing your hands, for at least 20 seconds, covering your nose and mouth if you're not vaccinated, especially if you're in congregate settings. If you're traveling, it's still mandated for a plane or a train or those types of transportations. But if you're traveling, you should be wearing a mask. If you're inside a setting where there's high infectivity rates, you should be wearing your mask to protect yourself, because this is how this travels. We had the 4th of July, and we're kind of seeing those numbers now spiking, and it's at the optimal time that you would be seeing it around 7 to 8 days after 4th of July. That's when you start seeing our numbers increase. And so it makes sense to us that are contact tracing. But public health, we really don't want to go through this again. I know the community doesn't want to go through this again. I know the hospitals don't want to go through this again. So do your part. If you don't want to get vaccinated, hey, that's your decision to make, but wear your mask, because it's okay if you don't want to get vaccinated. It's not okay if you end up in the hospital, because you're putting an extra burden on the hospital medical people to have to try to take care of another COVID patient. And that's what we're trying to avoid.
Perfect. And Annette, do you know where I can maybe find some numbers pre 4th of July of hospitalizations and cases? And then now, is that still on the website?
It should still be on the website, but again, I think those numbers were probably 17 or 18 hospitalizations a day, and now we're almost at 50. So, yeah, more than double.
Wow. Is there anything else you would like to say on this topic?
I think awareness, just be aware of what's going on, be aware of where you're going if you're traveling, and protect yourself, but never forget to protect your little ones. Your little ones, the only protection they have is you